So Matt has a question. He's from North Dakota. So hi, Matt. In your clinical experience, what medication works best for treatment of social anxiety disorder? Are there any specific meds, SSRI, SNRI, that you see work best? Um, okay, so you were present for my soapbox, right? Okay, so looking at root causes first, looking at, thinking of anxiety as a symptom versus a disease. Okay, make sure you do your homework and make sure that there's nothing else going on that could be contributing to that. Oftentimes too, especially social anxiety disorder, this could be a result of fear-based response. So it's something that your brain it has been wired to. It's like you've trained your brain to be anxious in these settings, and it happens over time for many reasons. And so definitely working with a therapist, especially for social anxiety disorder, is first line treatment. So making sure you're in therapy, you're trying to figure out your triggers, trying to figure out like how this developed, and trying to break that cycle. Definitely that first. Look at your diet, look at your lifestyles, look at, are you sleeping well, etc. All those things are important. And then when it comes to medications, start with SSRIs. That's where you start. Looking at something like for SAD, something like Citalopram can be helpful. And then if that's not effective, going, from there, and then moving to an SNRI if SSRIs are not effective. But I would try a couple SSRIs first before going to SNRIs, just because of increase in side effects, and SSRIs being more well tolerated, with escitalopram being one of the best well tolerated. But sometimes you may need something a little different, like fluoxetine, because you get a little bit of the norepinephrine, dopamine, as a downstream effect to some of the serotonin receptor sites that are being blocked, such as 5-HTC. So, anyhow, start with SSRIs, but first skills, like I mentioned, looking at your lifestyle, your diet, exercise, sleep, then SSRIs first. Tiffany from Virginia in the US. So what is your input on Mydayis? Oh yeah, I said that already. Any tips on taking it? Oh, tips on taking it. I actually also, I'm glad you added that here to this slide, because I do want to mention something. When it comes to stimulants, especially those working on the amphetamines, the amphetamine salts, there is an issue with when you're taking these medications. First of all, you want to take them in the morning. Best to take them on an empty stomach and just take it down with water. Why? Because increasing citric acid in your GI tract, meaning by drinking something like orange juice or lemonade, or some teas will have a lot of citric acid in them, can decrease the absorption of it, speed up the metabolism of it and make it less effective. So that would be my tip on taking it, and that's with any stimulant. That's like your Adderall, Vyvanse as well, that works on the amphetamine and salts, dexedrine, etc. So definitely making sure that you take it on an empty stomach and just take it with water. Also avoiding adding things like coffee and other stimulants, because now you're going to make yourself more prone to side effects. But yeah, I'm glad that you added those tips on taking it, because those are important factors to remember with stimulants, especially the amphetamine salts. How can I get off citalopram? Has been on it 6 years and it's hard to get off. 20 milligrams. Been on it for 6 years. Okay. Yes. So like I was saying before, I gave some advice with the benzo. It's the same thing with antidepressants. So especially citalopram, that can be a hard one to come off of. So making 5% reductions, every 4 to 6 weeks. And when you make a reduction, this is with any taper schedule that you do. When you make a reduction and say you have pretty significant withdrawal symptoms in those first couple of weeks. And that's your clue that, like, say you did 4 weeks and then you made the reduction and then you had, you know, some severe withdrawal symptoms, but then they settled down after a couple of weeks. That severe withdrawal symptom like response is like your clue. Next time, do 6 weeks before your next drop down. And I always say too that when you have the withdrawal symptoms, stabilize for at least 2 weeks. So make sure you get stable, and then don't do any adjustments to at least, you know, 2 to 4 weeks after you get stable. So most people will find stability at about 2 weeks when they do a drop down, and then wait and then go down. But if you have a severe withdrawal symptom, like, you know, when you make that first drop that's worse than the one previous, then you have to go slower. So it's very individualized. You have to monitor your symptoms. Also, another thing to keep in mind is that you want to, if you haven't already, because oftentimes people who are experiencing this antidepressant quote unquote poop out that they say, like when they stop working, or maybe been on multiple meds, or now you're getting side effects of the medication and want to come off, it's because you've ignored underlying issues, you've ignored root causes. And so making sure that you're assessing for those root causes before even starting the taper. Okay, so that's going to be like definitely number one, and what I like to do, because if you start a taper and then you get like, you start having real problems and then you're stuck and you can't find stability on a stage, by that time it's really hard then to now reverse back to looking at root causes, because now you're going to be sensitive to supplements and sensitive to all these different things that can actually help you during your withdrawal process. And that's a mistake a lot of people make. A lot of people, they'll come to me after they're already in this stage of dysregulation from a antidepressant withdrawal and say, help me. And I'm like, okay, we're kind of doing this backwards. We should have done this before you even got on the antidepressant, or before you even started your taper. And so things look a little different. It's a lot more challenging, unfortunately, for the person. But so if you haven't started your taper, I would say to start there with diet, and make sure that you do your labs, look for root causes. Oftentimes nutrient deficiencies are your number one root causes: vitamin D, B12, folate, maybe you have the MTHFR, maybe it's inflammation, etc. And so yeah, so that's my whole soapbox on deprescribing and coming off of it. And that's the same advice for benzos, it's the same advice for, you know, antidepressants, etc. And also, one of the reasons why some people can get off a lot easier than others, it has to do with, you know, these underlying root causes and ruling them out. And my one video on mental health labs touches on a lot of those root causes and the labs that you should do at least first, like the basic labs that everyone should do before getting on psych meds. And then I have another video that talks about the root causes of mental health and why antidepressants don't work. That one will also give you a little bit more detail on what I'm talking about when it comes to these root causes. Okay,